Hi everybody, I'm Holly Kouvo from Fitting Fitness In, and welcome to Get Healthy with Holly. Today I have a guest, Scherrie Keating from Diabetes Care Consulting. Welcome, Scherrie.
Thank you so much for having me. I'm excited to join you.
Oh, great. And I just want to give a little bit of background on Scherrie. Scherrie and I have known each other for a few years. We reconnected, what was it, October, when we were both speaking at the Massachusetts Council on Aging Conference. That was great to see you again. Scherrie is a registered nurse for over 36 years. She's a certified diabetes care and education specialist. She is the CDC National Diabetes Prevention Program lifestyle coach. She's certified as an ageless grace educator and a certified dementia practitioner. She offers healthcare professionals, community, and corporate wellness educational programs on proving lifestyle changes that help people prevent and manage insulin resistance diseases to include prediabetes, type 2 diabetes, and type 3 diabetes. Scherrie uses her passion, personal cancer journey, and expertise to inspire people to make small but significant changes towards living a healthier lifestyle. Love that. She produces and hosts a health and wellness show and a podcast called Talk Me Healthy. She speaks at state, regional, and national conferences and was featured in the Boston Voyager magazine as one of their inspiring stories. Welcome again. Sorry if I choked on that.
No worries. Thank you.
Awesome. So Scherrie, you know, diabetes is quite the disease, and there's all different types of diabetes. So can you give us just a little rundown about what types there are and how they come into somebody's life?
Yes, actually, the main types are type 1, type 2. There's a new one called type 3, which we'll talk about in more detail later, and gestational diabetes. Those are the main types of diabetes. So type 1 diabetes, it used to be called juvenile diabetes, but now they have found that people older can have type 1 diabetes. And type 1 diabetes, our pancreas, there's specialized cells in the pancreas called beta cells. They produce insulin. So when you have type 1 diabetes, you are no longer producing insulin. Those cells have been destroyed. An autoimmune disease, trauma, they can destroy those beta cells and they're not making insulin. So that's type 1. Type 2 is the most common form of diabetes. It is about 90 to 95% of people living with diabetes have type 2. It's a disease of insulin resistance, meaning that those specialized cells are still making insulin, but our body's ability to utilize it is impaired. And therefore, think about insulin as a key that unlocks the cell door for sugar or glucose to float in to be used to fuel our body cells. When we become insulin resistant, that key is not unlocking that door. Glucose isn't entering the cell to be used for fuel. Instead, it is actually going in through the bloodstream and accumulating and attacking the small blood vessels. And so type 2 diabetes is a disease of lifestyle. They think obesity is the root cause. And there's other risk factors as well. Sedentary lifestyle, a history of gestational diabetes, which we'll talk about in a minute. Things like high blood pressure, cardiovascular disease, you know, being overweight. So those are, smoking actually is a new risk factor. So those risk factors contribute to being insulin resistant, and so our body doesn't use insulin, and we develop small and large blood vessel disease like eye disease, kidney disease, nerve disease, cardiovascular disease, stroke. Type 3 diabetes is new in the last 15 years. We're going to talk about that later on in the interview, but it's a disease of insulin resistance, but instead of targeting the body, it targets the brain and leads to Alzheimer's disease pathology. It's fascinating, fascinating research. And then we have gestational diabetes, which when a woman is in week 24 to 28, the hormones tax those beta cells in the pancreas, and they develop diabetes in their pregnancy. Most women, when they deliver and the hormones go back to normal, they will not develop diabetes, but they are at risk. Some do develop diabetes, but the majority of people, when they deliver and their hormones go back to normal, they don't develop diabetes, but they're at risk for type 2 diabetes, and so is their child, so they need to be screened, definitely.
Wow.
So those are the main forms of diabetes.
Yeah. Well, there's certainly quite a different types of diabetes. So what are the most important things that people with a high risk of diabetes should know but may not know?
So people at risk for diabetes, so there's a thing called prediabetes, and that is actually why I started my company. When I heard the statistics that we could prevent diabetes and that there was this thing called prediabetes, I, as a nurse in diabetes for years and years, didn't know we could prevent diabetes, because when we're a nurse in diabetes, we actually talk about managing diabetes. We're not talking about preventing diabetes, because they're coming to us to manage diabetes. So when I found out you could prevent diabetes and there was actual science to back it up from the diabetes prevention program, I became a lifestyle coach through the CDC and their National Diabetes Prevention Program. And what I want people to know is that screening, testing, and acting today is critical. You can take a 7-question questionnaire, and it takes 1 to 2 minutes, and you can be screened to see if you're at high risk for developing type 2 diabetes. So I offer the screening tool on my website. You can go to doihaveprediabetes.org and take the test. It's called the test, but it's really a risk questionnaire. And if you score 5 or higher, you likely have prediabetes. Then you need to be tested with a blood test to confirm that. And then the most important thing is you need to act today. So what do? The study shows that if you eat healthy and exercise, but what does that mean, eat healthy? Well, the science for diabetes prevention shows that if you reduce the bad fat, which is the saturated fat, and you decrease your calories and you exercise 5 days a week for 30 minutes, you can reduce your risk of developing type 2 diabetes by over 58 to 71%. And the older you are, the bigger the reduction in risk. So I want to empower people to actually take that risk test. I actually just launched a diabetes prevention community on my new online school. And so I'm actually offering a free webinar on the 28th. And it's a webinar on prediabetes. And there's a screening tool that you take, and it's free. So I encourage people to go to my school, and I can give you that information after, and take that test, and then join the free webinar. It's on the 28th from 4:30 to 5:30. So
On April 28th?
On April 28th, yes.
Awesome. Well, and we'll make sure that we put that in the credits at the back of at the end of the program where they can reach that. So, you know, it's funny that you should say that, because my dad had diabetes, and you know, I kept saying, Dad, you have to exercise more, you have to exercise. And so he wasn't very good with taking his blood sugar. I was there one day, and he got up and he took his blood sugar. It was 180. And I said, he's like, well, how am I supposed to bring it down? I said, Daddy, go for a 20-minute walk. 20-minute walk. And then he came back. We took his blood sugar, 130.
It makes a huge difference.
It was huge.
Yeah, makes a big difference. And I think too that people think for diabetes prevention, remember I said you had to exercise 5 days a week for 30 minutes. People say, well, now maybe they won't say that because we're in this whole pandemic and people are at home and they have more time. But the science shows 10 minutes of moderate exercise, even walking, simply walking 10 minutes at a moderate pace 3 times a day can reduce your risk the same as walking a 30-minute exercise session. So
we call those exercise snacks.
Yes.
A 10-minute snack.
There you go.
I mean,
I love that.
Even if you can't go outside and you have some stairs, just go up and down the stairs over and over, or walk around your rooms, you know, just to get, or just march in place. You know, do some high knee marches, just something to get your cardiovascular exercise, and it just burns out that blood sugar level.
Absolutely.
So that's good. So what's the most important thing people with diabetes should know that they may not know?
Well, what I try to tell people is you can live a long, healthy life with diabetes. And we're talking about type 2 diabetes because that's what I specialize in. Type 1 diabetes is a whole different conversation, but let's talk about type 2 diabetes. You can live a long, healthy life with type 1 too, but I want to specifically target type 2 because that's where my area of expertise is. So the most important thing is controlling your blood sugar. We call it the diabetes ABCs. Blood sugar, blood pressure, and cholesterol. Those are the diabetes ABCs. How do you control those? By doing 7 daily self-care behaviors. And they're healthy eating, exercise, taking your medications, preventing high blood sugar and low blood sugar, getting preventative screening so you can prevent the complications of diabetes, healthy coping, and blood sugar monitoring. So those are 7 behaviors that you can do to lower your diabetes ABCs and get them in the target range for you. Everybody has a different range that's appropriate for them based on a lot of different factors. And so you work with your diabetes care team and your certified diabetes care and education specialist, and you formulate an individualized plan that fits into your life, your beliefs, your cultures. You're the driver of your plan, and you work with this team of diabetes experts to help you with that plan so that you can manage your diabetes on a day-to-day basis, so that you can keep your blood sugar, cholesterol, and blood pressure in the target range for you so that you can live a long, healthier life with diabetes.
That's really good to know that each person is individual, because I thought, my dad's blood sugar levels were getting up to 200. I'm like, Dad, that's really high. And he goes, oh, not for me. And I'm thinking, really? But everybody does have a different range. So yes, you have to work individually with your doctors and your diabetes care consultants. So what about type 3 diabetes? Let's touch on that now.
All right, so in order to understand type 3 diabetes, you need to understand insulin resistance. So remember, we talked about insulin is the key that unlocks the cell door for glucose or sugar to go in and be used for fuel. So in the body, when we develop insulin resistance, we're still making insulin, remember, but we're not using it properly, so that sugar's not going in the cell, and it's instead accumulating in our bloodstream and putting us at risk for a lot of health issues that we had talked about. So insulin has a different role in the brain. And insulin in the brain regulates 2 proteins, beta amyloid and tau, and those are 2 proteins that are associated with Alzheimer's disease pathology. It also has to do, insulin also regulates, it's critical for signaling. Signaling has to do with how insulin works in the brain, and also insulin is critical for our brain cells to grow, survive, and critical for learning and memory. There's a lot of insulin receptors that are located in the memory and learning parts of the brain. So when everything is working fine in the brain with the insulin and it's doing its job, then our brain and our memory and learning part of the brain is working. When we have insulin resistance in the brain, it affects, insulin has to attach to a receptor that's on the outside of a cell. So when you have insulin resistance, there's a problem with that connection to that receptor. And that receptor connection we call binding is very important, because if the insulin can't attach to the receptor, then the insulin action is prevented, whether it's in the body or in the brain. So in the brain, when the insulin can't attach to that receptor on the outside of the cell, it doesn't signal insulin to act the way it's supposed to. So beta amyloid and tau become abnormally regulated, and so beta amyloid will clump outside the brain cell, and tau will twist and tangle, and the brain cell won't get nourished. And so the brain cells actually will die and the brain becomes smaller. And these are the same things that we see when somebody has Alzheimer's disease. So Dr. Susan D. Lamont is a neuroscientist at Brown University, and she's the one and her team that coined the term type 3 diabetes. So what it essentially is insulin resistance in the body leads to diabetes, cardiovascular disease, hypertension, polycystic ovarian disease, women that are trying to get pregnant that can't because of insulin resistance. So it leads to a lot of different things. But in the brain, when you have insulin resistance, what her research showed was that it leads to the same pathology that we see in Alzheimer's disease. So what she actually did was she studied brains of people that had passed away from Alzheimer's disease, and she looked at the different stages of Alzheimer's disease, and what she found was the more advanced the Alzheimer's disease, the more problems with insulin resistance in the brain. So what she did was she looked at rats, and she actually gave them a drug, one dose in their brain that actually induced insulin resistance in the brain, because she wanted to see what happened. And what happened was all the pathology that we see in Alzheimer's disease, she saw in the rat's brain. Then she said, well, if it's a disease of insulin resistance, but it's targeting a different organ, instead of the organs in the body that leads to diabetes and all those other diseases, in the brain when it targets it, she said, well, it's insulin resistance. Why don't we try diabetes medications that we use for insulin resistance in the body and use it in the brain and see what happens? So she did that in the rats, and she found that their memory and learning were actually preserved because there were more insulin receptors in that learning part, in the memory part of the brain. So now they're actually researching medications that we use for diabetes to slow the progression of someone with mild cognitive impairment to progress to Alzheimer's disease. So this is really cutting edge research. It's very complicated, and we need an hour to talk about it. Yeah. But I mean, I kind of tried to sum it up a little bit. So the bottom line is insulin resistance can target different organs in the body. Based on the organ that it targets, it will lead to different pathology or abnormalities, which will lead to different diseases. And so insulin resistance is really the problem, and insulin resistance is something we can control. We need to, guess what? Eat healthy. We need to exercise. I know, we need to exercise our body and our brain. Right. We need to go more plant-based. We need to watch our head for head injuries, because any head trauma can increase our risk. So all the things that prevent, like diabetes and cardiovascular disease and strokes and hypertension, elevated cholesterol, the bottom line is we need to go to lifestyle. Lifestyle is really the bottom line, whether we're talking about insulin resistance in the brain or whether we're talking about insulin resistance in the body.
Really, the lifespan of a person is really determined more by 70% more by lifestyle versus your DNA.
Huge factor. Like, right. and that is why I'm so passionate about trying to, we all have had to rethink how we run our businesses, and I own my own business and I'm a national speaker. And so everything just came to a halt. So I was kind of feeling sorry for myself, thinking, okay, I don't have a business anymore. What am I going to do? And then I was, watching everyone putting everything online, and I was just like, oh boy, that's, like redesigning my whole company. But what I realized is that I was feeling sorry for myself because I'm a nurse. I'm at high risk. I can't make a difference on the front lines. But then I had my aha moment saying, I can still do what I love to do and still make a difference, but do it online. So I'm launching this whole school to educate people on lifestyle and how they can prevent chronic diseases, diabetes, and all those associated other diseases by changing their lifestyle.
And that's why we get along so well.
Because we're both all about lifestyle, right?
Exactly. I mean, I've had clients who have been on maybe 5 shots of insulin a day, and I get them consistent on exercise programs and eating healthy. And one person came off of all those shots of insulin. I mean, stayed on his metformin, but I mean, really, and he was blown away. Really, it makes such a huge difference. Okay, so now...
We really can't stress that enough, to be honest with you. I just want people out there who's listening. It's a small change. I'm all about the small changes that have huge impact in the future. Just make a small change today. Start walking 5 minutes. If you've never walked before, walk 5 minutes. Tomorrow, add another minute. The next day, another minute. All of that increment of time make huge differences in the outcome of your health in the long run.
Right. Do those exercise snacks.
There you go. I love that. I'm going to steal that from you, Holly.
I did a show on that, exercise snacks. I'll have to bring that back.
Yes, please.
Okay, so now here we are, where everybody's sheltering at home. Well, at least in most places, definitely in Massachusetts where we are. And everybody is more at risk when you have diabetes. So explain why you're more at risk when you have diabetes.
Well, can I So when you talk risk, I want people to understand that just having diabetes increases your risk related to the seriousness of an infection, the flu, pneumonia, hepatitis, COVID-19. It's not the risk of contracting the disease. It's the risk if you do contract the disease, the severity and the worst outcome is really what we're talking about here. When you have diabetes, the biggest thing is controlling your blood sugar. If you are uncontrolled in your blood sugar, your immune system is affected. And that's where the risk comes in. So if you do get the flu, you get hepatitis, you get pneumonia, you get COVID-19, if you have chronic elevated blood sugars, that's where the problem comes in, because your immune system is suppressed and you are not able to fight the infection like somebody who doesn't have diabetes, who has a healthy immune system, and you're going to have more complications of the illness, and your outcome may not be as good. So I think the message here isn't that you need to be concerned about the risk of contracting it. We all have that same concern. The risk is if you need to get your blood sugars under control, because your immune system is going to be suppressed if you don't, and then the risk of, if you do develop it, that your outcome is going to be worse.
Right, right. So, I mean, just all the things that you talk about to lifestyle changes just for your diabetes to bring your blood sugar levels down and control and maintain them are the same exact things that you're going to tell us that you need to do to make sure when you're healthy if you do contract COVID-19, that you can fight it.
Right. And, of course, you need to follow all the CDC recommendations, and you also need a sick day plan. So when as a certified diabetes educator, well, it used to be called that, and I'm still getting used to the change in terms. So we used to be called certified diabetes educators. But because we do so much more than just educate, the credentialing board and the National Association decided that we really needed a name to reflect our multiple roles that we do. So now we're called Certified Diabetes Care and Education Specialists. And what we do is just like it says, we do diabetes care, education, and ongoing support. And we work with the person living with diabetes. We come up with that individualized plan of care. And one of those things is a sick day plan, so that regardless of just COVID-19, whenever somebody with diabetes gets ill, they need a plan in place. They need to know what they need to do. Do they still take their medication? The answer is yes, even your insulin. You still need to get a certain amount of carbs with your meals. If you can't eat them, you need to drink them. You need to stay hydrated, especially older adults. You need to be checking your blood sugar more frequently if that's something that you do normally. You need to be notifying the doctor if your fever, well, with COVID, it's over 100.3. If you're having, nausea, vomiting, diarrhea for over 6 hours in a 6 times in a 24-hour period of time. If your blood sugars are over 240. So you need to be doing all of these things, and you need to have a plan in place. So before COVID-19, your plan should have already been there. So if you don't have a sick day plan, that's really important. And you can go on the American Diabetes Association website, which is diabetes.org. And you can also go, I wrote it down, the Diabetes Care, the American Association of Care and Education Specialists. Their website is diabeteseducator.org, and you can go and get all of that information on making a sick day plan. You need your doctor's numbers, you need your current list of medications, and now they're doing telehealth visits. So it's really important that you maintain your appointments via telehealth, and also prescriptions, making sure that you have extra prescriptions, because if you can't get out of the house with the COVID-19, sometimes the insurance companies are actually being more flexible with the prescription limits in terms of getting your prescriptions extra to keep at home, and all your supplies that you need to administer your diabetes medications like insulin, and making sure you're communicating with your doctor. So having a sick day plan is critical, and it should have already been in place, but if it isn't, you need to do it now. So
that's a great point. That's a great point, especially if you're living alone.
Absolutely. And, Lifeline would be a great thing for somebody with diabetes that has frequent low blood sugars. If you're living alone, having a lifeline, because, they can, if you have a fall because you had low blood sugar, because when you have low blood sugar, you're a higher risk for falls and confusion. And so having that lifeline, so that if you fell or you went unresponsive because your blood sugar was so low, you will get help immediately. So, all of these things should be part of your sick day plan. And, we never know when something's going to happen. We didn't know this was going to happen. And having all of those things in place is critical.
Absolutely. So let's just go over where people can go to learn about diabetes. And I'll also put them in the credits. And then up on my website, when I post this on my website under Get Healthy with Holly, I'll also list all of these resources. But let's just go over again where they can go to get information.
So the American Diabetes Association, which is diabetes.org, the Center for Disease Control, the CDC, the American Association for Care and Education Specialists. That's the new organization, and it's diabeteseducator.org. And then I have my school, which is on Thinkific, and I'll send you the link. It's called Diabetes Care Consulting School of Education, and I'm going to be launching 1-hour webinars for people living with diabetes and at risk for diabetes. So we're going to talk about healthy eating. We're going to talk about label reading. We're going to talk about pre-diabetes. We're going to talk about how to, those 7 behaviors, those daily self-management behaviors, complications of diabetes, preventative screenings, insulin resistance of the brain or type 3 diabetes, ageless grace. We're going to be talking about all of those things that we talked about in this interview, and I'm going to have a 1-hour webinar, and that will be launching soon. And my diabetes prevention community is already launched. So if anyone's at risk for prediabetes and they want to jump in on April 28th, I'll give you that information as well.
Okay, great. And I'll include that on my website as well. So your website is Diabetes Care Consulting with a K.
Consulting.com.
Diabetescareconsulting.com, and I'll have that link up there as well. And I guess the motto is, eat right, exercise, take your medication, monitor your blood sugar levels, and, try to stay as healthy as possible.
And do that sick day plan if you don't already have one, and really continue to do your screening test, continue to communicate with your diabetes care team, via telehealth. Look for signs and symptoms, follow all the CDC guidelines, mask, hand washing, social isolation, all of those things. Those small changes make a huge, significant impact in your health.
Well, Scherrie, thank you so much for being on my show today and the wealth of information that you have shared with us. And maybe we'll have you back another time.
That would be great. Thank you so much for having me, Holly. And I hope that you and your family stay well, and as well as the viewers.
Yes, and you too. All right, everybody, thank you for joining us on Get Healthy with Holly. I'll have all that information up on my website, fittingfitnessin.com, as well as in the credits. You can take a look at all the information in the credits. And I look forward to seeing you next time on Get Healthy with Holly.